they are sending a message to people who get in their way that if they don't cooperate with them, their children, their spouse will be kidnapped and likely killed. When they in fact decapitate a rival drug dealer, for example, or a police officer, they will leave the body in a very public and conspicuous place, and they will add additional bodies to it because there's never just one. There are always more rival dealers, for example, to contend with. So they'll pile up the bodies, and then they will roll the heads into public gathering places, into civic meetings, into restaurants. If you think I'm expressing this simply for effect, you are right. But it's also important to understand that what I am describing is in the news. It's in the New York Times, it's in the Washington Post, it's certainly in those newspapers across the border. This is what is happening today. 230 American cities play host to Mexican drug cartels. 230 cities now have the presence and the influence and the muscle of Mexican drug cartels who have decided, for very obvious reasons, that you can cut out the middleman, you can move to more fertile territory in the states, and essentially carry out your business and make even more money. Now, there's an added motive for Mexican drug cartels to do this, and that is in their own homeland. As of the last 2 or 3 months, the government has moved to decriminalize all drugs. The possession of, not the sales, not the trafficking, the possession of. So a whole lot of theoretically prime buyers within their own national jurisdiction are no longer available to them. Not that that was a huge source of income to begin with, because the huge source of income rests north of that border in the United States. We are the greatest demand nation for illicit drugs. And we have a lot of money. And we realize that because of prohibition, the drugs are going to cost a lot of money, and we're willing to pay that money. We also realize that corruption of government officials, including police officers, is an inevitable byproduct of prohibition, just as that violence is. Police officer who dips into somebody's pocket, pulls out half a baggie of marijuana, converts it to his or her own use, or uses it to set himself or herself up in business. Perhaps building a continuing criminal enterprise where all kinds of money can be made. So you hear in every city in my country, there has been at least one drug trafficking related scandal in which a police officer has set himself up in business and built a syndicate around that business and engages in exactly the same kinds of behavior that the cartels exhibit. They kidnap, they rob, they extort. They also, because they have police powers, and because they know that most of the people from whom they steal drugs will not report it for obvious reasons, have an advantage over the cartels. 230 American cities hosting drug cartels, police officers engaged in corruption. I don't want to give you the wrong impression. The great majority of American cops, and I dare say in your country as well, are not in this context in any way character challenged. They will not seize and convert contraband to their own use or start selling it. But it's such a cliche, but all it takes is one. In one city, if a police officer does that, what's the level of trust and confidence in the local police force itself when a police officer can in fact engage in that kind of corruption? Your city has a strong history of that. We were just talking about Roger Rogerson. See, everybody responds. It becomes part of the folklore, but it also becomes part of the truth. Whether or not it's got a factual basis today that police officers are engaged in corruption, it certainly leads one to the conclusion, based on what was accomplished by this individual back in the day, that it's still happening. So it hurts. It hurts trust between community and police. It damages the reputation of the local law enforcement agency. It does no one any good. But violence and corruption are inevitable byproducts of prohibition. And finally, let me just say one last thing before we start our conversation. It isn't just violence perpetrated by drug dealers, by the cartels, by the street traffickers. It is violence committed by drug users, and particularly addicts, that creates a huge problem in local communities around the globe. If I am a heroin addict, I need to shoot up, right? 2 times a day, 3 times a day, perhaps 4 times a day. I have a certain dose that I know I need. I need my heroin as much as a diabetic needs his or her insulin. I have to get it. And because I am living a chaotic and oftentimes miserable lifestyle, not always, but often, I don't have a way of getting a job or keeping a job that would allow me to get enough money to do what I need to do to sustain my addiction. I may hate my addiction. I may love it. I may hate it. Even if I hate it and don't want to be addicted, I am. It happens to be what it is. Therefore, if I can't be gainfully employed, I've got to steal and fence property. I've got to prostitute myself. I've got to deal drugs in order to finance my next fix. This is systemic. It doesn't describe every heroin addict. It certainly describes many. It creates a situation in which police officers and many citizens in our communities and neighborhoods judge addicts and find them wanting and find justification to treat them with less than full dignity and respect. It creates a situation in which the long arm of the law automatically, unthinkingly carries out a campaign of enforcement that more often than not does far more harm than good. But it is what it is, and it's important, I think, that we all recognize this social reality. I could not be more impressed by the agencies, the organizations that I've seen, including, given my superficial brush with this one thus far, NUAA. It's remarkable, it's incredible what social service agencies are doing. And we all know that it's not enough. We all know that there is no social service agency, no nonprofit agency that has enough money, enough resources to serve satisfactorily the patients or the clientele who rely so deeply on their services. I am concerned for your city. I'll just be presumptuous when I say that everyone in this city who knows anything about this organization, the medically supervised injection facility, the methadone clinic, any and all social service agencies that are struggling to stay afloat in some cases, struggling mightily against political pressures that may in fact be brought to bear in the future that could result not just in underfunding, but the demise of at least one of these agencies. It's really important, I think, for people to organize, to mobilize, and send a message to their government that a heroin addict needs a safe place, a supervised place to inject, and for the police to honor that process. That is a function, I'm convinced, of political will and political power. And so I would end actually with an appeal to anyone who is not, and that may be no one in this room, anyone who has not made a phone call, sent a letter, banded together with others to attend a meeting and to press home this critically important responsibility in support of desperately needed social and medical and health services in your communities. That's really what I had in mind by way of what I was going to say at you, and so I'm really now looking for conversation, concerns, questions that you may have of me. Yes, please.
Thanks for